This question came in a couple of days ago. Hello, Dr. Doreen. My name is Lisa. I have a child diagnosed a year ago at age 7. Mm-hmm. How can I teach him fear to danger? Going back to last week's program where we were talking about that, she says in order for him to understand eloping and wandering, that it's dangerous. I tried to scare him a bit to show him what can happen. I yelled at him out of frustration when he was in danger, and nothing has worked thus far. He still forgets and does it again. Is the ADHD diagnosis he has in addition to his ASD to blame? He's very impulsive and forgets things instantly. Also, in regard to the viewer, we had a viewer last week who asked about an IEE, and we thought it was a misprint. Apparently, in some places in the country, they call, when you have your child evaluated, she has informed us, they call it an independent educational evaluation. Mm-hmm. So thank you for sharing that. And she says it's when a parent is not happy with the result of school evaluations, you can ask the school in writing for an IEE to get the child reevaluated with a non-district affiliate evaluator at the school district expense. Love that. Okay, so thank you for sharing that information because somebody will benefit from that. And then let's go back to the 7-year-old who diagnosed a year ago, so now he's 8.
Okay, so the very first question is, how on earth could he be diagnosed at 7? So what was going on before that?
Yeah.
And the assumption I would have to make is that he is extremely high functioning, that no one saw anything going on until age 7. So
that would be my hope. I don't know, we don't know. And if you're watching live, write back and tell us. But certainly for a child who has no sense of danger.
No, there's just no way that sense of danger you could have if you have, very, very high functioning PDD as it used to be, or Asperger's. You could still have problems with understanding danger. I just can't imagine that the child would ever have a diagnosis of autism and not be diagnosed until 7. That just doesn't seem possible to me. However, let's assume that this is a very high-functioning child and has a lot of ADHD symptoms, which sometimes could resemble or be paired with let's say Asperger's type symptoms. So I'm imagining a very high functioning child who doesn't have a very good comprehension of social norms and so on. So yes, the ADHD type stuff, the impulsivity can certainly be responsible for not paying attention to danger. There's no question about that. In fact, with any of us, if we are impulsive, if we rush, we tend to not pay attention to danger. Okay,
True.
It's just very simple. If you're in a rush, you might do things that are more dangerous.
Yeah.
So if if you see that as being one of the main things, like you see actually that the child is always too fast, you need to work on slowing down the child. But if it's just a matter of like him really not understanding the concept of danger or fear, then danger is really very, very clearly just an association that occurs with fear. So anything that we consider dangerous is something that is associated with fear. Now, if you're a little bit older, or if you have cognitively developed in that area, you're able to internalize that in a way that you don't have to experience every danger in order to know that it's dangerous.
Right.
So you don't have to burn your hand in order to know that fire can burn.
Right.
The way you know that is by, for example, looking at the fear reaction of a parent and understanding what they're thinking.
Yeah.
So that goes back to perspective taking, of course. And if you have a hard time being able to, understand the emotions of someone else, then you're going to have to experience it yourself. There's going to have to be a classical conditioning of fear to a certain situation in order for it to become dangerous. That's just that simple. Okay. It goes back to that example that I had given with infants and how they would have like a snake in front of the infants, and the infant would just as well touch the snake, because there is no fear of objects at that point, until a very loud noise was made behind the infant, and then the infant automatically associated the loud noise to the snake, and then the snake became something that they wanted to avoid. The thing about classical conditioning is that the association has to be paired almost instantaneously. In fact, it's a half a second that you're allowed to separate it. In other words, the conditioned response, or the item, like let's say you want to teach your child danger from crossing the street.
Right.
So within half a second of the child, let's say, attempting to put their foot across the curb, within half a second, a fear-evoking thing has to happen in order for the two to be paired, and that's the most successful, is the conditioned stimulus and the unconditioned being fear itself. The two things have to be paired within half a second in order to be effective.
So she writes in, I've tried to scare him a bit, and I don't know what that means, a bit, but potentially where I know I would make the mistake as the parent that I don't think I would have known the half second.
Yeah, I mean, that's the formula for classical conditioning is, I think some of the words may have changed nowadays because they keep changing these things, but it was CSUS, so that means conditioned stimulus is paired with the unconditioned stimulus. The unconditioned stimulus is the fear-evoking stimulus, whatever that really does make you afraid, for instance. And that's very important. So like when you say I've tried to scare him a bit, it just may not be potent enough.
It might not be something that actually scares that child. We talked about loud noises last week.
And you actually brought up those, what are those things
air
called?
horns.
Air horn. That's like the best idea ever, because an air horn will startle pretty much anyone, right? And so the concept would be to practice this with, let's say, he puts his foot off the curb and you will do the air horn, but you have to do it in a way that he doesn't know you have it. Right? Because if he knows, he will come to anticipate that if you are there, this happens. If you are not there, he's pretty safe. And then that's one way of doing it. I mean, so the typical way that children will learn these things, obviously, is through the concept of seeing other children or other individuals being hurt, right? And I don't think that he has that capability. I really don't know. If he does, then it's kind of like, what am I talking about? They do this with us when we go to traffic school. If you speed or do something like that and you go to traffic school, or even online, where they show you horrific videos of accidents and things that scare the life out of you.
They try to scare you straight. That's what they do.
I'll never forget. I remember seeing an ad a few years ago in England. Actually, we'd never had these commercials here, but it was a commercial I will never forget, because it was about people who were sitting in the back seat. You know, in the UK they mandate seatbelts also in the back seat. And this was just a horrifying commercial. Like, I remember seeing it, and from that moment on, I always insist everybody in the back seat put their seatbelts on, and it is just such a scary thing. You never will forget. So that's really the primary way of doing it. But obviously, if your child doesn't connect, isn't able to watch a video or hear a story or a scenario and apply it to themselves, then they have to have the direct experience. And don't make the mistake of thinking that scaring the child a little bit is going to be adequate. You shouting at the child is probably not going to be enough.
But again, and we said this last week, and you can go back and watch last week's show to find out much more about this process. This doesn't mean that you terrorize the child. This doesn't mean you torture them, and it doesn't mean that you hurt them or put them in harm's way.
That's right. And this is very, very important, because when we overuse, if you end up over exposing your child to a fearful event or to traumatizing event, then actually, in addition to psychologically damaging in terms of the child becoming fearful of many things, the fear-evoking event stops. It becomes neutral. The child will become habituated to it. So, we all, actually, it's really funny, but even something like an air horn, you can habituate to.
Yes.
So you just don't want to produce something on a continuous level that is like traumatizing. This is just to provoke a sort of an adrenaline reaction. It's the fight or flight response in the child. And in order to do that, you need to be able to connect the danger with some form of alerting stimulus.
So I go back to with this question because it is a safety issue.
Yes.
And it is such a concern, and the parent has been trying some things on their own. That
Yes.
would it be remiss of me to say that really you really should be working on this with an expert?
I think that would be critical because, first of all, I still have a lot of questions in this case because first I can't understand why the child's issues wouldn't have been recognized until 7. But anyway, I do really recommend that you work with an expert, especially if you have a dual diagnosis of ADHD, which until this year wasn't even possible.
Right.
But now let's assume that you have a recent diagnosis, and I'm just guessing that might be ADHD and ASD, Asperger's type, or very, very low severity ASD. I still have a difficulty with just that in itself. But anyway, I would really suggest that you do, and it could be something as simple as once your child is given medication or treatment for the ADHD, these issues tend to subside because you really are, if you can slow the child down to pay attention to what is going on, he may very well remember the fact that something could be dangerous. I
will say that, and you are an expert in the field of autism, and you are world-traveled, and you go all over the place, and you see all different kinds of circumstances. But I will say that I don't have your faith that the people who were around this child recognized it and said something to the parent. I think it is possible still, at this point in time, disappointingly so.
7?
It's unconscionable.
I've only ever, Shannon, in my entire career, had one child that I diagnosed, and he was 7, and that was a child who came from the Middle East and was very, very protected, and it was very, he just, nobody really wanted the diagnosis, let's put it that way. But 7, it's just, the symptoms have to be extremely mild, in my opinion. If you're in the United States.
I hope you're right.
Yeah,
I hope you're right. But we'll wait to hear back from this parent to see.
Yes.
Because
we'd like to help more, actually, if we know a little bit more.
Absolutely. Okay. Moving on, we've got a question that came in on the Facebook. What can I do when my oldest son, the one with ASD behaviors, rub off on his typical 5-year-old little brother? For instance, chewing. It was never an issue with our youngest, but after seeing his brother do it his whole life, he has picked up on this as well as along with other things. And I'm assuming that the chewing is chewing things that you don't want them to chew on. Obviously, we want kids to chew food, right? So I'm assuming that if it's a problem behavior, chewing on other things, whether it's the shirt sleeve, their hand, the pencil, toys, or whatever.
Right. You have to, this is the beauty of behavior analysis, is that it doesn't just apply to kids with autism. Obviously, it applies to anyone. So what do you do? What's the first stage when you have a behavior? What are you supposed to do?
You got to find the function of the behavior.
There you go.
I'm a good student.
So before I even respond to that, you have to identify why the 5-year-old is doing this.
Okay.
So it's not, yes, it's an imitation because he has the stimulus to imitate, but his function still remains. What is the function? Is he doing it in order to gain attention? He could be, because there's a lot of attention on his sibling, and he thinks, if I do the same thing, they'll give me attention as well.
Right.
So in that case, obviously, you need to make sure you are giving him a lot of attention when he's not biting.
Right.
And you are, you still block or prevent the biting. Is he doing it because he needs some sort of sensory stimulation? Is he doing it because he is trying to avoid a demand? Is he doing it because he wants access to something? I don't know. And that really does help determine how you treat it.
Yeah.
So perhaps you will give us some information, and then we can help further with the function. And again, I want to say that's why I love the BIP builder, the BIP builder, which is beautiful because it together with the CIFA, which is sort of the assessment portion of it. So online, you can answer questions about this particular behavior, and it will really give you a bunch of ideas on how to deal with it. But really, you cannot stop a behavior unless you know the function, because you could be potentially intervening in the wrong way.
Okay, and really important, because when we take the time to come up with an intervention, we want it to be effective, and
Absolutely.
we certainly don't want to make it worse.
That's right.
And if we don't know what the function of the behavior is, we could make it worse and make a bigger mess if we're not going about it in the right way.
Correct.
I always liken it to when you have something go wrong with your car. You don't just pull it into the garage and say to the person, I know it's this, rip all that out, I'll pay thousands of dollars, without looking at it first and determining if in fact that is what's wrong with it.
Exactly.
And we care infinitely more about our kids than we do about our cars.
Right.
So let's take the time to figure out what's really going on before we start to think that we're going to intervene and repair something.
Yeah, it's very important. I mean, the procedures will be the same. It'll be a lot easier because of your typically developing child will be able to pick up on what your intention is very fast. But it's really important. Most of the time when I have a child imitating a sibling who is affected with ASD, it's attention-seeking behavior most of the time. But, it could be anything.
And that makes a certain amount of sense.
Absolutely.
Kids are trying to figure out, how do I fit into this family? And this person who's older tends to do X, Y, and Z, and they get a whole lot of attention. Well, then why don't I try that?
Exactly.
And if it works, then I'm going to keep doing it.
Right.
And a lot of times, I know you have said before on this show that it can start out as one thing, but it can snowball into other things, other benefits from it too, because sometimes chewing feels good.
Oh yeah, absolutely. And that's why a lot of times when you have chewing behavior, you want to actually replace it with chewing something that's more appropriate, right? Like gum or something like that. But yeah, it is a very, very sensory type activity. And so again, you'd have to identify why it started, and then we treat it from there.
All right, great. And if you need more information, you'll write into us, and we'll be happy to ask a follow-up of Dr. Granpeesheh. We're going to take a short break, and we're going to be back with more of your questions that are coming in both on the Facebook and the live feature, so stick with us. Welcome back to Autism Live and to Ask Dr. Doreen. We're here with Dr. Doreen Granpeesheh, an expert in the field of autism, been working with children on the autism spectrum for multiple decades. She is a great resource. If you have questions, you can be writing them in on the live feature at autism-live.com, and also we're taking questions right now on our Facebook page, Autism Live on Facebook. This just came in on the Facebook page. My 10-year-old has side effects from risperidone. He can't take ADHD meds. What could his doctor try for him next?
That's a tough one to answer, but the question is, why is he on risperidone to begin with?
Okay.
So, risperidone tends to reduce everything. It's an antipsychotic. It basically will put you down, it'll make you a little bit more lethargic. So it is often used for things like treating behaviors. It's also used for treating self-stimulatory behaviors and so on. And I often, very, very few of our kids, and I'm talking, 2,000 kids at CARD, very, very few of them are on risperidone, actually, because we try to gain control over their behaviors through behavioral means, intervention. So ideally, you would not really want to be using both medication. Obviously, you're not going to be using risperidone and, let's say, Adderall together. That would be kind of difficult. So I'm not sure. I think you need to try to titrate off the risperidone, and then perhaps then you can actually start working a little bit more with the ADHD medications if necessary. But it would be probably a good idea to see a psychopharmacologist who can help balance his medications a little bit more than just let's say a psychiatrist or a neurologist. And then you would also really want to have behavioral interventions that can help reduce the need for some of the meds.
Yeah, and just on a related note, I want to say as a parent, and as I get to meet parents all the time, one of the things we're really talking about this year is quality ABA. Because I think one of the heartbreaks that I find is I meet a parent who says, well, we tried ABA for a little while. We had like 12 hours a week, and we had it with this company, and they weren't getting it done. And so our our doctor put him on this medicine. I didn't really want to go on the medicine. I didn't want to put my child on the medicine, but it was what I was told was going to work. And my heart breaks for that parent because they weren't given the full
choice or chances
or the prescription for what was actually going to work
if
they had done ABA.
Yeah, it's such a good point.
And then they gave up on it because they were told, well, that's not working. So they went against their gut instinct, put their child on medicine, and now they're finding out that in some cases their young boys are developing breasts because of this medication. And a lot of times these parents feel left out. But I would ask if you could say a couple of words on how effective quality ABA is as opposed to some people are out there doing a very watered down version of ABA.
Yeah, this is really, really, really important. Thank you very much for bringing this up. It's kind of like, it's so outside my universe that I forget, because how long have I been doing ABA now? Well, that can't be. Is that true? It's like, I don't know, more than 30 years.
Right.
So, 34 or 5 years, a long, long, long time. And I have to say, I've never really known anything other than really high quality ABA and actually pretty intensive ABA. In other words, obviously when I have Asperger's adolescents, let's say, or, teenagers who have just a few issues, or very, very high functioning, let's say children who used to have a PDD diagnosis who are very high functioning as well, I would not be doing a 40-hour program, but I'd be doing a lot of work. It's kind of like tutoring, if you look at it this way. This is very, very important stuff. If you have a child who is not doing very well on a class, let's say math class or whatever, and you give them instruction an hour and a half, 1 hour and a half session a week, they're going to learn during that time, but just so much. So their grades might go from a D to a C, or from a D minus to a D plus. It's very simple. If you give them 10 hours of instruction, they might actually shoot all the way up to an A. It's just a matter of how much support and help you give. Now, that is one aspect of it, which is the actual quantity. Now, the other aspect of it is if you have a tutor who goes to teach your child, calculus, and all they really know is geometry, your child's not going to get a lot better in calculus. So you really want to make sure that the person who is working with your child is not just, working on reducing behaviors, because, and we've talked about this numerous times, the majority of people who get trained in this field are very focused, and this is just because of the way things are taught. This is gradually changing, but the field of ABA is very much focused on behavior and changing behavior. So while behavior analysts are very good at changing behavior, they aren't comfortable, or let's say they don't have access to curriculum materials, so they don't know a behavior that they're changing. Let's say it's tantruming and I want to reduce the tantrums. A behavior analyst can really do that very well. But this is a nonverbal child and I want to teach the child to speak. That is something that is still a behavior that I want to increase. But the behavior analyst really doesn't have a whole lot of training on how to produce speech, how to, and they have to have had the experience, learned from or use a curriculum like skills. Skills is our curriculum, obviously, or work with a speech pathologist, or gain some expertise in that area over the course of the years so that they can adequately handle whatever the issues are. So quality and quantity of ABA is an enormous issue, and I agree with you. It breaks my heart as well when I hear parents saying, I did ABA, it didn't really work. ABA works, period. If it's good quality ABA and if it's enough, it works.
Yeah.
If it's not working, that means it's either not enough or not good enough. So one of those two things, and it's just, that's
it's never the child.
It is never the child, never the child. It's always just the procedures, the amount, the techniques, is the child being reinforced adequately? Are the instructions clear enough?
And so we don't want to assume with this parent who wrote in about the risperidone and the meds, but we certainly want to encourage you that if you to make sure that you've exhausted your possibilities of dealing with this behaviorally.
Exactly.
That if you haven't found the person that you feel like really addressed it behaviorally, keep asking until you find that person.
That's exactly
while you're also talking to your doctor about medications, because some children, as you mentioned, very few, but some children, that's going to be the go-to.
Absolutely. I mean, and you know, I said very few in terms of risperidone. I don't really like risperidone, you know. It's too much for our kids. It's too much for anyone. It is one of the very few FDA-approved medications for autism, but you know, there are other medications that I'm a very strong proponent of for our kids, medications that help control their anxiety and so on and so forth. But having said that, you know, it is very difficult if you have a child with an ADHD diagnosis, for instance, or children who need ADHD medications, you know, they really are just functioning at a very much higher speed. So
okay, all right, very good information. We're going to take another short break, and we'll be back with more of your questions. So stick with us. Welcome back to Ask Dr. Doreen. Dr. Doreen Granpeesheh is here with us in the studio answering your questions. We just had something come in on the live feature. Hello, Dr. Doreen and Shannon. I have a question for Dr. Doreen. What is the best strategy for behavior function escape with behaviors like screaming, acting silly, throwing themselves to the floor, mouthing? We tried not to let escape happen, but she tries all, and it's very time consuming. I want to make sure we're doing the best technique. We know it's escape because when on the high pick, she asks for a break. When the break is given, she will request break every minute. Any advice is appreciated. Please give us some light. We love you. Thank you.
That's great. Thank you so much. So, good job, first of all. Like, what a great question. Well, so, you know, so basically, let's remember what all this means. What all this means is that she's doing all those behaviors. And what were they? They were throwing herself on the floor, screaming,
acting silly,
mouthing, and mouthing objects. Mouthing isn't usually escape maintained. I have a hard time with that one. So to reevaluate the function of mouthing. But the other two very common, obviously, acting silly and you know, trying to avoid doing something, and throwing yourself on the floor and so on and so forth. So the whole process is when something happens and you've identified the function and you've identified it to be escape, you will not allow the child to escape the task. So yes, it is very time consuming because now the child's throwing themselves on the ground. Try to prevent them. First of all, try to block the throwing themselves on the ground. So in other words, I'm not sure what activity the child's escaping from, but let's assume it's basic demands, you know, any kind of activity that you tell the child to do and they'll act silly and scream and throw themselves on the ground. Try to sit in a position or in a way that the child can't throw themselves on the ground. If they do throw themselves on the ground, you're going to have to motor them through the activity so that they're not escaping it. So a couple of things you could do is you could, and this has to do with the comprehension of the child, you could increase the activity. In other words, there's a response cost system built into this, which means, oh, if you throw yourself on the ground, I'm still going to force you to do it, but now you actually have to do it more, like longer, or, you know, more objects, or whatever it is. So there's sort of a kind of a punitive aspect to it, and the child starts to realize this isn't really worth it because not only I'm not getting away with it anymore, I am not able to escape doing this behavior. That's the message that you want to get to your child, is this is not going to be a functional form of communication for you to escape. Yeah. Having said that, you've already given your child the ability to say break, and then now you're saying your child is abusing the ability to say break. That's okay. What you do is you will start on a timer. So like you can start to, when the child asks for a break, first of all, you give the very, very, very short break initially. And then what you'll do is from the time they start, you'll start now counting 2 to 5 seconds before you give it to them. So essentially you're giving them a break, you're giving them a very short break, and you're gradually having them learn to wait before their break. Another thing you could do, and this again depends on the child's comprehension level is you will still give the break, but you'll gradually start to require the child to request break 5 times before they get a break. So every time they ask for a break, you put a thing on the table and it'll accumulate to 5, and then you'll give them a break. So you can increase the latency, you can increase the demand request. There's a lot of things that a behavior analyst can help you do. This really has to do with the comprehension level of the child. Don't worry that your child's overusing the break request. Here's another thing you can do is, again, depending on where your child is, you can increase the demand, the criteria for how they ask for a break. In other words, you can have the child start having to say, I want break. Like, use it to get more language. So those are the types of things that you do. And then you'll just, I would recommend, because I don't know your child very well, I really do think this is one of those things that would be very useful to have a behavior analyst with you. If you go on the BIP Builder will give you other ideas as well of how to control escape behavior. And also always remember, you can't deal with 4, 5, 6 topographies all at once. It's a little difficult. If they're all function-based, then you're going to have to really, the same function, if they're all escape-based, type behaviors, then it's going to be kind of tough to prevent all of them from happening. So it's kind of a little bit difficult right now.
What my mind goes back to is when I think Jem was in 1st or 2nd grade, we went through a rough patch where he didn't want to do his homework.
Yeah.
He wanted to come home, and what had happened before that is that he would come home and there would be a therapist there when he got home from school, and the first thing that they would do was play with him, to get him into where they could work with him for therapy, right? Now all of a sudden he was a little bit older, the therapist was coming a little bit later, and I had a wedge of time in which the homework had to happen. Yeah. Otherwise it was going to be bedtime. I couldn't move it around. Right. Or at least I didn't see that I could in that moment. And boy, he didn't want to do it, right? And I didn't feel like I had a whole lot of options. So instead, I just fought with him. Yeah. And what would happen is the therapist would get there, and the house would be in disarray. He'd have ripped up the homework. Pencils would be everywhere. Right. And then we'd have to work backwards, lose half the session. And finally, I bought a vowel and said, I think I need some help here. Yeah. I consider myself a fairly intelligent person, and this wasn't our first dog and pony show with ABA. I kind of knew some things, and I knew that he was trying to escape it. But the therapist came a half hour early, and we went through everything that was happening. And she said, on Thursday, this is what we're going to do, and you have to be really well slept for this. And I went, oh. Oh, wait, I have something, and there's an antecedent for me as well. I have to be well slept. And she had me mentally prepared and said, this is how we're going to do this. He came home, and I was very nice with him. We had a lovely moment. I gave him a couple of minutes, and then I said, it's time to do the homework. And he got up there, and the first thing that he would do is he would throw his pencil on the floor. And then in the amount of time that I would have to bend over to pick up the pencil and give it back to him, that was escape. It was maintaining itself, right? So I had a cup of pencils that were already there, so he would throw the pencil, no reaction when he would throw the pencil, no discussion about why are you throwing the pencil. I would stick another pencil in his hand and put my hand over his and start to write. Well, I was so glad a therapist was there, because then he realized I'm not going to get out of this, so he upped the stakes, right? And so the papers are on the floor. I had extra papers because the therapist had prepared me. And then he flung himself on the floor, and I went with him on the floor, no escape, pencil over his hand, and was still writing the thing on the floor with him saying, "What's happening?" Yeah. Right? What's happening? And no reaction from me at all. I just continued to move his hand, and as you said, motor him through the thing. Yeah. And, he kicked, he screamed, whatever, and no matter what, and the therapist kept talking to me, and we kept writing. And finally he said, "Can I get up?" Yeah. And I said, yes, but we kept the pencil on the paper as he got up, so there was no break in it. It was the last time. Yeah. It's just, our kids are smarter than you think, But thank you for saying that, because it's so important also that's a really great example of not only preventing escape behavior, but also letting the child understand that you will not really give a huge amount of attention to negative behavior. Having said that,
the other side that I wanted to make sure I address with this family is the positive aspect, which is, if your child is trying to escape a task, you should be reducing the complexity of the task and increasing the reinforcer anyway. Okay, so on the one hand, you want to reduce the escape behavior, obviously, and teach the child a more appropriate way to do it, which is ask for a break. On the other hand, you should make sure that the child is enjoying the task, or it's not over their head to the point where it's hopeless and they need to escape it. So the easiest way to avoid to reduce escape behavior is not let the escape occur, as Shannon said, and reward the child for actually doing the task. So really increase your reinforcers. That will really reduce your child requesting a break because they'll be enjoying the activity. Yeah. So that's number one. So, that's the most important thing, is always look at the activity and make sure it's fun and possible to do.
And of course, that's the part that I forget. But of course, the therapist had built in too that there was going to be a big reward for getting the homework done.
There you go.
That he got a big reward, that if there was a timer, and if he got the homework done within a certain amount of time without all the shenanigans,
right,
that he got to do something that he really wanted to.
There you go. And that's
but of course, I would forget that part.
Sure, and of course there's the key as well, is that the child understands that, a child who's asking for a ton of breaks obviously isn't going to be able to complete a certain number of items within a time frame. If you want them to pay attention to the time frame, you use a timer. If you want them to just get through a certain number of activities, you can cross off each one or put a check mark as she completes them. Again, it really does, it has more to do with the task that your child is trying to avoid, but you increase reinforcers for doing the task, and then prevent the child from using those tactics to take breaks.
But I also appreciate the parent saying it's so time consuming and it's energy consuming. And I loved that therapist saying to me, we're going to do this on Thursday and you have to have this together. You got to have the cup of pencils, you got to have extra papers, and you have to be slept really well, because otherwise, and can I just be honest and say, there's no way that I could have followed through on that intervention if I hadn't had somebody talking me through it.
Sure.
And saying, you're doing a great job, don't give up now, and all that stuff. So I go back to you saying, get your ABA team on board with whatever the intervention is, because it takes a village.
Yeah, absolutely. It really does. It really does. And like for this child, again, if she's overusing the concept of asking for a break, then have a certain number of things required before each break. So like you have to answer 5 items before the break, and then you'll get a major reinforcer. Like those simple manipulations help things a lot. Okay. That was a great example. I'm proud of that therapist.
Yeah, well, I had the best. What am I? We're always saying that I had the best, which is why I'm always trying to pay it forward. We have a question that came from. We have a young mom who's studying to be a BCBA who's watching the show and loving it, and I'll have to share the whole email with you. But she messaged us on Facebook and said, my question for today, we've talked a lot on the show about the ABCs of behavior and having, putting the paper and folding it in 3. So you got the A column for the antecedent, the B column for the behavior, and the C column for the consequence. And she's saying for the A and the C of the ABC recording to work out the function of a behavior, how far into the past and future do you go? I'm sure with some behaviors the function is obvious, but if it's not clear, would the person doing the function assessment look beyond the immediate antecedents and consequences? I can imagine there are behaviors which might be influenced by what someone ate for breakfast, even though the behavior is happening hours later. And she goes on to say, a while ago, you had somebody talking about how their child's behavior had become much worse when she changed his diet. Similarly, though, delayed gratification would generally be something we'd aspire to. I can imagine a family being so stressed by a meltdown that evening they compensate for the day's stress by not cooking and ordering in a pizza. And then the child has sussed out that every time he gives them a rotten day, he ends up having his favorite food. So, but I love this question about how far do we go back? If the child has had a tantrum and we're filling in the behavior and we filled in what the consequence was, how far back do we go for the antecedent, and how far forward do we actually go for the consequence?
Right. That's an awesome question. It's a question that would only come from a mom. Because moms are thinking about so many other things. So I would say the general answer to that is that you go further back the higher functioning the child is.
Okay.
So if a child is sort of very, very severely impacted by autism in terms of like just not really being able to comprehend cognitive concepts yet, then it's more likely that the antecedent is pretty immediate. If the child's very, very high functioning and you're looking at a child who's more of a child with Asperger's or really high functioning child, then yes, it could entirely be true that this is a longer term influence. So in other words, it's a manipulation of some type or some antecedent that occurred, yesterday even could be producing the behavior. The example that you give is a very interesting example, especially for someone who's becoming a behavior analyst. So you use the example of like the motivation is to want a certain food and then to act out because when I act out, the family is overwhelmed, and mom doesn't have time to cook, and we may get pizza, That would be a very simple thing to habit to break. That is entirely possible. Of course, absolutely, our kids do this, no question about it. You could easily break that and order out, but order, Indian food, something the child might not necessarily like, I don't know. So then they'll figure it out. That's a very smart child. That's what I love about our kids. That's why I often tell, at intake, when I talk to our parents, I'm often asking them about these types of manipulative behaviors because they do indicate intelligence. Like, when you have a very intelligent child and they manipulate you, what are they doing? They're understanding the function of your behavior and figuring out how to manipulate your behavior by producing those particular antecedents. So that's terrific that your child's doing that. Now, you brought it's a really fascinating example because you used food. So food happens to be one of those things that has an extremely long, let's say, half-life, more than anything else. In other words, food as a positive reinforcer or food as a negative, as a punishment, tends to have the longest effect of anything that exists. So in other words, let's put it this way, it is extremely strong in its effect and it is extremely durable. So some examples. They had these experiments where they had wolves, and a wolf would be with a flock of sheep and would attack the flock of sheep, obviously, and eat the sheep. And then this would become something that obviously wolves can smell that out, and it's a very, very, very strong conditioned response, right? So anytime there's a sheep nearby, the wolf will attack it. Now, the sheep were then injected with something that made their skin smell different. And also in another experiment they were given they had something put on their skin that was toxic to the wolves, not toxic in the point in terms of killing them, but in terms of making them sick, vomit. And the conditioning was so strong when it had to do with a conditioned food aversive, so eating something that made them puke later, that there was no way they could recondition the wolf to ever eat sheep again. Wow. So food tends to be, it's our primary reinforcer as well. It tends to just have a different effect than anything else. So yes, the pizza thing is very, very possible. However, let's say if the child figures out that if I mess with my family and they're extremely exhausted, and so then, they're going to let me sleep later, that might not happen. Okay. But food will very likely happen because kids get conditioned to food so fast, and it's such a strong, enduring conditioning stimulus. But I mean, going back to your general question, it could go back, the motivation or the function could go back pretty far. those more abstract or complicated functions tend to happen the more the child understands.
Okay. So the older the child, the higher the functioning of the child, the further back you would want to go.
Yes.
Great rule of thumb.
Yes.
I love that. That would never have occurred to me. Okay. We got a couple of more questions here. Something that just came in. Thanks, Dr. Doreen, for all the great tips. Shannon, thank you for sharing your story on escape behavior. I wish I'm able to do that for my 10-year-old's undesirable behaviors. He taps his fingers, hum loudly, jumps up and down sometimes, and this draws a lot of attention. I don't know the exact function, but it looks like this. It looks like about 60% sensory, plus 10% habit, plus 10% attention seeking, plus 10% escape behavior, plus 10% testing my patience. I want to do the math on that. Does it add up to 100? For example, he does these behaviors in his school bus, and other typical kids giggle at each other while my child does not have a clue on getting embarrassed. I'm worried if he's going to be like this forever. Any tips would be great. Thank you, Dr. Doreen and Shannon. Great question. I have to say, it kind of fits with, we had another question that came in from a teacher about these kinds of behaviors and how other kids react to them. So we're along the same lines. So tapping fingers, humming loudly, jumping up and down sometimes, and this draws a lot of attention. But looks like 60% sensory, 10% habit, 10% attention seeking, 10% escape behavior, and 10% testing my patience.
Yeah. So testing my patience is attention seeking, by the way.
Okay.
It's the same
so now
thing.
we're at 20% for seeking attention.
Right. Because testing your patience means you lose it, and that is attention.
That's good theater. When we lose it, I'm convinced.
Yeah, when we lose that is attention.
Look at that. That's better than the TV. That's better than Nickelodeon. Mom's hair is standing straight up on end.
Yeah, it is. It's humorous. So I guess you have to identify the function of each behavior. So I just, there's no way to do it other than that. When you have this many behaviors going on at the same time, it's too much for you as a mom to want to deal with. Generally, you will need a behavior analyst. The behavior analyst will typically identify all the functions, but then will start to deal with, I guess, the most important first, and the most important being the one that is the most harmful to your child. Embarrassment is a completely different concept. Let's not even go there for a minute. I mean, I understand that you don't like the fact that he's not aware that other kids are laughing, and I would feel the same way, but that's a whole different instructional issue than behaviors. So if you think that a large portion of this is sensory, make sure that your child has other appropriate means of gaining sensory stimulation. Tapping his fingers, perhaps your child is musical and needs to have some form of musical activity that will help satisfy the need to do this, like playing the drums. That always takes me back to our little guy who used to always do this, and now he's a fabulous drummer, right?
He's a professional drummer.
He's a professional drummer. And you need to, you will take that need and put it into something that's more appropriate. I don't remember what the other ones were. So
humming loudly, jumping up and down.
Yeah, exactly. So the humming and tapping would indicate to me that your child should probably be involved in some musical activity separately. Singing, drumming, with headphones. That would give the child the ability to have a period of time each day, multiple times a day, where they can sing, hum, tap, play musical instruments, jump up and down, dance, all of that, and you will constrain it to that period of time, and it can't be done at other times. If the function is escape at other times, you just make sure they're not escaping anything. But I don't know if the function is attention seeking. You give it a lot of attention if it's during that time frame that I mentioned, but you don't give it attention if it's outside of that time frame. It seems like there are too many behaviors going on at the same time, and it sounds like you're pretty exhausted and wiped out from it, and I really do recommend that you try to get a behavior analyst to give guidance just on this. Most behavior analysts would be able to guide you through this. Another thing you can do is you can go on the BIP builder, just get for 3 behaviors or 5 behaviors, answer those questions. It'll instruct you step by step what to do. Another thing you could do is just get the module on how to handle challenging behavior from IBT. I mean, you do have some resources. Ideally, of course, if you have a behavior analyst who has a team of therapists, I would love to be able to just say that's where you should go. But I know that in a lot of the world, you don't have those resources, and you'll have to learn these things yourself and apply them. But it is very beneficial to learn these things and apply them because they help you throughout life. It never really ends. I mean, my children are much older, and my children, forget about just your children, you apply behavioral techniques throughout your life all the time. So the more you know, the better you'll do.
And I what I'm hearing, and I'm sort of applying this to our whole topic last week, was chunk it for everything that we have to do in life, because everything can be so overwhelming to us, sensory stuff, and I got to do this for my child, and I got to do this for my job, and I got to do this, it's all coming from, and we can't do it all in the same moment.
That's
but
right.
To chunk it, and what I heard you say is prioritize this.
That's right.
What behaviors do you want to work on between 3 and 5? What's the priority? And the rest of it, you're going to have to let it go for a couple of minutes, because you can't carry this whole thing. And then our whole topic this week is taking action. So once you've prioritized and said, these are the 3 behaviors that I'm looking at and seeing are the biggest problem, and I'm looking at it, and the embarrassment is an issue, but I'm gonna save that for a month from now or 2 months from now. But deciding how am I going to take action on this with the resources that you have available to you.
Right.
She kind of gave you a good, better, best. Best is that you go to your ABA team and say, let's work on this together. What's the plan? Here's the BIP builder. Let's build the plan together. You're going to implement it at this place. You give it to the school so they can, and then you're doing it at home. But if you don't have that option, there are lots of other ways that you can get at it.
That's right.
But you can't try to do it all today.
Right.
And you can't do all these behaviors all in one fell swoop. I love Dr. Tarbox always says to us, how do you eat an elephant? One bite at a time.
Yeah.
Sometimes I don't know which end of the elephant do I start at.
That's true.
But you're going to look at it, and you're going to, based on what Dr. Granpeesheh just said, you're going to look at it and say, all right, this is where I'm going to start.
Right.
And then take some action on it today.
Yeah, and I know life gets so busy, and we're constantly trying to just keep up with life, and sometimes you have to just take a breath and make a plan. That's the more important thing. It's not about dealing with it every second of the day, but it's actually about, maybe you should be focusing your energy on how do I actually get a team of behavior analysts in here rather than trying to fix it yourself. Sometimes it's just overwhelming and we need some help.
Yeah, absolutely. Absolutely. So write back to us if you need some help figuring out prioritizing or how to get a team working with you or how to get your team all on the same page. Whatever it is that you need at this moment to help you to get to the next level, write back to us and we'll be happy to address that as well.